Gearing up for your nursing skills checkoff, that head-to-toe assessment can feel like a mountain to climb, right? Well, in this explainer, we're going to walk through every single step, from the very beginning to the very end. The goal? To help you nail it with confidence and precision. Okay, so here's our game plan. We'll start with the setup, then dive into the head and neck, followed by the chest and abdomen. After that, we'll tackle the upper and lower extremities, and then bring it all home with the wrap-up. We're going to cover every single step in this exact order, so you'll be more than ready.
You know, when you look at the full checklist like this, it can definitely feel overwhelming. I get it. But don't you worry. The whole reason we're doing this is to break it down into small, manageable chunks. This way, it'll be so much easier to remember and to perform with total confidence.
All right, let's get started with section 1, the setup. Now, these are the absolute must-do first steps you need to complete before you even lay a hand on the patient. Honestly, getting this part right sets the stage for a successful assessment.
Okay, first things first, you've got to review that patient's chart. You're looking for the basics like age and gender, but also digging into the medication administration record, the MAR, any known allergies, and their medical history. Then, once you're in the room, it's all about privacy. Close that door, pull the curtain. Ask them if they need to use the restroom. And hey, if a specimen is ordered, now is the perfect time to collect it. Next up, your initial implementation steps. Introduce yourself, verify their identity. You need 2 identifiers like name and date of birth. Explain what you're about to do and get their consent. Make sure to warm your hands. Nobody likes cold hands. And put on clean gloves if you think you might come into contact with any body fluids or if you see any open skin. Then you can start the hands-on part by taking their vital signs, asking about pain, and getting their weight if you need to. And here's some of the exact phrasing you can use. By telling the patient what you're doing step by step, like, I'm closing the curtain for your privacy, or asking about pain, you really build that trust and make them feel comfortable. Remember, you're not just ticking boxes, you're taking care of a human being. Okay, with our setup all done, we can finally begin the physical assessment, and we always start from the top. Let's go through every single checkpoint for the head and neck. First, you're going to assess their level of consciousness. You'll check if they're oriented to person, place, time, and situation, and you'll also want to note if their speech is clear. Next, take a look through their hair and check their ears for any issues. Then, for the eyes, you're assessing their pupils' response to light and accommodation, checking the white part, the sclera, for any yellowing, and the inner eyelid, the conjunctiva, for paleness. Moving on to the face, you're looking for symmetry, checking their skin color, and just observing their general mood or affect. Then, have them open their mouth so you can assess the mucous membranes, teeth, and gums. And finally, check the neck veins for any bulging, and always inspect any tubes or dressings they have on their head or neck. This brings us to a super important acronym you absolutely have to know and use in your charting, PERLA. It stands for pupils equal, round, reactive to light, and accommodation. Saying and charting PERLA is your shorthand to show you've covered all the critical parts of the eye exam. So to check that level of consciousness we just talked about, here is your script. Asking these 4 specific questions is the standard way to quickly and accurately figure out if your patient is oriented. All right, now we're moving down to the torso. This section is all about using your eyes, but maybe even more importantly, your ears. We're going to be listening very carefully to the heart, lungs, and bowels. So start by just looking at the chest. What's its shape? Is it rising and falling symmetrically? Does their breathing look easy or labored? Next, you'll assess skin turgor, and the forearm is a great place to do this. You just gently pinch the skin. What you're checking for is elasticity, which is a great indicator of how hydrated they are. Then, grab your stethoscope. You're going to listen to the heart sounds for a full minute at all 4 landmarks. And you need to note the rate, the rhythm, and the strength. Okay, listen up, because this next part is a critical step, and you cannot do it by yourself. To check for a pulse deficit, you must bring another nurse in to help you. Here's how it works. One of you listens to the apical pulse with a stethoscope for a full minute, while the other takes the radial pulse at the wrist for that same minute. Then you compare the numbers. This is a mandatory check, and you have to do it with a partner. Once you're done, your partner can leave. Now, while that second nurse is in the room with you, it is the perfect time to show your instructor what you know. Go ahead and verbally list all the major pulse points, just like you see here. Start at the head with the temporal and work your way all the way down. This is a great way to score points. Next up, we're listening to breath sounds. You'll want to ask your patient to take slow, deep breaths through their mouth while you listen. And remember, you have to listen to all 5 lobes. That means from the front, the back, and the sides. You're listening for the quality of the sound, any extra or adventitious sounds, and making sure the sounds are equal on both sides. When you're done, be sure to ask if they've had any cough, mucus, or shortness of breath.
Now let's talk about the abdomen. The order you assess it in is so important. And to help you remember it, we have this fantastic mnemonic from Miss Catherine. I am pretty polite. I is for inspect, A is for auscultate, and P is for percuss and palpate. Why this order? Because you have to inspect and listen before you touch. If you start poking around, you can actually change the bowel sounds, and we don't want that. So following that mnemonic, you'll start by just looking at the abdomen. Then you'll listen for bowel sounds in all 4 quadrants. And if they seem quiet, you might need to listen for a minute or 2 in each quadrant. After you've listened, then you can gently palpate the abdomen, feeling for any firmness, masses, or tenderness. And to finish up, you'll ask about any nausea or vomiting and get the details on their last urination and bowel movement.
Okay, we're moving right along to the arms and hands. For all the extremities, we're going to use a simple but powerful framework that covers everything you need to check: circulation, sensation, and motion. And here is that framework, CSMT. It stands for color, sensation, motion, and temperature. If you can keep these 4 things in your head, you will perform a perfect systematic extremity assessment every single time.
So let's apply this to the arms. First, you'll feel for the radial pulses on both sides, checking that their strength is equal. Then you'll feel the hands for warmth, that's our temperature check, and for any swelling or edema. Next, look at their nail beds for color and check capillary refill. It should be less than 2 seconds. Assess their range of motion and test their motor strength by asking them to squeeze your fingers. And finally, you always want to inspect any IV sites or dressings they might have on their arms. We are on the home stretch now, for real. We're going to take that exact same CSMT framework and apply it to the legs and feet. First, inspect the legs and feet for their color. Are you seeing any paleness, any bluish tint, or any mottling? Next, feel the skin for temperature and check for edema around the feet, ankles, and over the shins. Then, you've got to find and feel the pedal pulses, the dorsalis pedis on top of the foot and the posterior tibialis behind the ankle bone, checking for equal strength on both sides. Check the capillary refill on the toenails. Again, we're looking for less than 2 seconds. Test their range of motion and strength by having them push down like they're stepping on a gas pedal and then pull their toes up towards their nose. And just like with the arms, you have to inspect any dressings or compression devices. And just like that, the physical assessment is done. But hold on, you're not finished yet. Let's go over the final super important steps that are all about patient safety and making sure you follow through. All right, here's your final checklist. Lower the bed all the way down and put the side rails up. Make sure the call light is right where the patient can reach it. Get them comfortable and ask if they have any questions for you. Then you wash your hands. Next, and this is so important, document everything right away while it's fresh in your mind. Remember, if you didn't chart it, it didn't happen. And finally, you need to evaluate all your findings. Compare them to the patient's baseline and report anything abnormal or concerning to the charge nurse or provider immediately. So we've gone through all these steps. And after all that, what's the most important thing to remember? Look, mastering this checklist is absolutely key for your evaluation. But never forget what you're really assessing. It's not just a